Hello everyone, I'm Dr. Hiren Mehta. I'm a local pulmonologist. I actually also sit on the board of Lung Cancer Initiative. I wanted to do another video answering some of your additional questions. This is a follow-up to Dr. Garza's video that she did earlier. That's a great video, by the way. If you haven't seen it, I really advise you to see that. That described kind of what COVID is, some of the risk factors, precautions. So she gave a lot of good information on that video, so I'd really advise you to see that one as well. This one I'm going to focus a little bit, it's just an informal video, and I just want to focus a little bit on some of the questions that we've had follow-up questions, and I wanted to focus on answering those. Some of which is, precautions. What precautions can we utilize as we move forward to opening up some of the states, and who are at risk, lung cancer patients, survivors, and survivors' family and caregivers. So I'm going to try to address all of those questions today. And go over how to wear a mask, what types of masks are there, just because I know there's a lot of information based on this and it's fairly confusing. So let's go over who's at risk. Okay, that's important so you know your own personal risk and your family members' risks. Okay, so CDC basically puts high risk category patients. So two independent risks are age, 65 years and older, and then anyone who lives in a nursing home or a long-term care facility. Those two categories are at higher risk for COVID infection. Then people of all ages that have certain risk factors include anyone who has underlying heart disease, diabetes, obesity, liver disease, kidney disease, and then whoever is got lung disease, severe lung disease, including moderate to severe asthma. Those are all the general risk factors. And then lastly, the one that I think we'd probably all be interested in is immunocompromised. And where does cancer, and more specifically lung cancer, fall into that? So anyone who's immunocompromised means that their immune system is down. So anyone actively receiving treatment for cancer, HIV, AIDS, any of those are at risk factors. Those are at higher risk of having COVID infection because their immune system is down. Where does cancer fall into all of this? Well, so cancer can be broken into two large categories. You have survivors who have completed treatment and who don't have active cancer, and then you have patients with active cancer and patients with active cancer who are receiving treatment. Now, a recent study showed that patients with lung cancer specifically and blood cancer, including leukemia, lymphoma, were at even a higher risk for getting COVID and having more symptoms based on COVID infection. And that's probably, lung cancer affects your lung, and already your lung volumes and function are affected by cancer in itself, and treatment sometimes to the lung can affect that, put you at underlying risk factor. And then hematologic or blood cancers such as lymphoma, leukemia, they affect the lymph nodes, bone marrow. These are areas that produce immune system, and so they directly reflect your immune system and can be harmful for you. So lung cancer and blood cancers are at higher risk. People with active cancer, based on a study that was recently published, showed were at higher risk for getting COVID. So you have to be really extra careful. So let's talk about survivors. One of the questions I received was survivors. Are survivors at risk for getting COVID? Well, theoretically, if you've completed your treatment and you are not undergoing any active treatment and don't have active cancer, your immune system should have bounced back. Unfortunately, we don't have enough literature, hasn't been studied enough to know definitively, but theoretically, your risk should be as equivalent to a general population, if not maybe slightly higher. Difficult to know. And then caregivers, again, you have to be careful. If caregivers are actively out in the public, working, they can carry the infection. Maybe they don't have a different risk factor, but they themselves can carry the infection. Children can carry the infection and not be clinically symptomatic, but carry that home and infect those that are higher risk. So you have to be really careful with that. So what precautions can we take as we get out into the public and as the states start opening up? Well, so the first thing I'd say is be careful. As the state opens up, the thought is let's open up to more essential, lower risk population folks. So you still have to be careful. If you fit into one of those risk categories that I put in there, even as the states open up, you yourself have to be very careful before you get out into the public and put yourself at more potential risk, okay? But as we get out into the public, what precautions can we take? Well, first and foremost, the most important things that you have to remember if you take anything away from this video today is social distancing. Even if you're in public, keeping away 6 feet from everybody around you. It's not rude to ask people to separate. It's what you need to do to stay safe. Hand washing. I know we're going to talk about hand sanitizer as well, but remember, please, hand washing is very critical. Soap and water. Remember, 20 seconds. The old sing happy birthday song twice in your hand as you use water and soap with warm water is ideal. If you don't have that, hand sanitizer. Hand sanitizer with at least 60% alcohol is critical when you're using hand sanitizer. Not all hand sanitizer is safe. You have to make sure that 60% alcohol at least, and having that in your pocketbooks, having that around so when you're out in the public you can quickly wipe your hands and clean your hands. That's advisable. And then masks. So we get a lot of information about masks in the news and in the press. What types of masks are okay? What types of masks should you wear? So let's start with homemade masks. So homemade masks have been approved by the CDC to use, and they're okay to use right now. I want everybody to understand, initial studies with homemade masks did show that they were not as effective as medical grade masks, including surgical masks and N95 masks that you guys have heard about. And I'll show you those later today. But they are still better than nothing. And making homemade masks, seeing if you have the appropriate homemade masks, you can go to the CDC website. They have a really good pictorial tutorial based on how to make a mask, what types of equipment you want to use and material you want to use, and how thick you want that mask to be. And that's a great video to start with if you're going to make your own masks or even acquire a mask, but see and you have the ability to ask the right questions if that mask is okay. The thought is that the mask itself may not completely protect you from getting an infection, but what it does is if you're clinically asymptomatic carrier, you will stop it from spreading to others. And so it's important to wear at least a homemade mask if you're out and about anytime. So that's number one. So the next thing is surgical mask. And those are the ones I'm going to show you. You guys probably don't have access to as much. So this is a surgical mask. This basically opens up. You put this around your nose. You wrap these around your ears like this. You pinch at the nose right there, if you can see. You pinch there at the nose. You open it up like that, and it should wrap and be tight around your face. And that's a great way to protect you from large particles. Now, this doesn't necessarily block all small particles or small virus loads, but this is a great effective way if you're going out in public to help protect your face if you have access to these. These are the ones you'll see dentists and optometrists, surgical procedures. They tend to have these on. They're called surgical masks, okay? And that's a simple way to use those. The other mask that you see is the N95 mask. That's the other ones that you've seen. Now, these are respirators. So these basically you put over your face like this and put the strap down like that. Again, you pinch here at the nose, and they technically should be very tight to your face. You can see it's very tight to my face. It even masks my voice a little bit because I can't open my mouth as much because it's tight to my face, and it protects you against 95% of particles. That's why they call it N95, because it should block 95% of particles going in, okay? So that's the N95 mask. There's another N95 mask also is this type. This is also a 3M version. It's very similar. All you do is you open it up like that, and you put it to your face, and you still do the same thing where you pinch it, but it looks more similar to this. These are also very safe. Now, the N95 masks are not for general population to use. Those are for healthcare workers. Those are the shortages we talk about that we have with PPE, personal protective equipment, and that's one of them that we're short on in general as a healthcare. But those are for healthcare providers that take care of COVID patients. So as a general population, you really want to stick with homemade masks or surgical masks if you have those. And that should be one of the things that you use when you're going out always. I did want to actually, before I forget, I've been out and I've seen people wearing these masks. Now be careful, you know, these masks get annoying after some time. So I see people doing this where it doesn't cover their nose because they get tired of it on their nose, or they do this. And you have to be really careful with that because you forget that you're supposed to have this on, remember, nose pinched to protect you. Can't have it halfway on just so you can breathe, because that defeats the purpose, because you breathe in viruses, and then that can potentially cause you symptoms, okay? Gloves, that's the last thing I really wanted to cover was, you know, a lot of questions about should you wear gloves out in public. So there's mixed feelings about gloves. The reason is when you wear gloves, you don't wash and wipe your hands as much. And the problem is I've seen people wear gloves and then they touch their nose and they touch their face. And what they're doing is they're getting germs on their gloves, and then they're touching their face because they're messing with their mask and all of that, and they're forgetting that you can actually carry the germs on the gloves itself. So if you're gonna wear gloves, use the hand sanitizer on the gloves to clean the gloves. But really, I'd say if you're not touching a lot of high traffic areas, you'd probably be better off just using hand washing and hand sanitizer. And that should be pretty safe as you move forward and we get back into getting out in the public. But again, if you hit any of those risk factors that I described earlier, you really want to avoid going out in the public as much as possible, and you want your caregivers to do the same when possible. Hopefully you guys find this helpful. If you have any questions, you can contact us. Lung Cancer Initiative has a lot of resources to help with this. And if you have any additional questions, please let us know. We can keep having regular update videos to keep giving you guys information as we learn more. And again, we're all learning more and more about this infection as we move forward, okay? Thank you.